Hello, my friends. It's Victoria Bell, and I am a registered nurse. However, this is not medical advice. I wanted to tell you what I tell my patients, what I teach them when I go into their homes and notice that they're not taking very deep breaths or they're struggling with their breathing. Breathing is a very important aspect of our life. Our lungs are meant to look like big, plump, juicy grapes, but when we stop using them, like maybe we're even already using oxygen, our lungs become lazy when we don't use them, and some of those lung sacs become like little raisins, and when they're like that, they're closed up, and the liquid fluid can build up inside of them and they can't get out, and that makes you more prone to infections. So you want to open your lung sacs out so the fluid could come out, and it will make you less prone to infections, and it will also help your breathing over long term to have more open lung sacs. Now, this is for everyone. This is not just for people that are obviously struggling for breath, but it's for people that are breathing shallowly. Like, are you still breathing? Okay, I can't tell, but their eyes are open and they're talking, or they get short of breath when they're talking, or they get short of breath when they go to the bathroom or to the kitchen. In fact, they don't want to do too much, either because of pain or shortness of breath. And so this is how you can actually reverse some of that. First, you want to add a little fresh squeezed lemon to your water if at all possible. Please watch my other video on that. And do the breathing exercises. They work in conjunction together. I've had people with COPD, pneumonia, people that can't, are on oxygen and oxygen dependent. It's known in the medical profession that once you're on oxygen, it is impossible for you to get off. However, I do ask doctor's orders to get doctor's orders so I can titrate people off when they're motivated. So you have to be motivated to get off of it, and some people can't. Okay, this is not for everyone. Everyone cannot get off of oxygen, but a lot of people can. I've had people with COPD get off of oxygen and be able to walk again and around the block even. So by adding lemon and doing the breathing exercises. Now, this is my favorite device. It's called an incentive spirometer. And the object of this device is you hold this little green disc in the smiley face. So you see the smiley face right there? And you take a baseline by measuring where you are at the first time you use it. So I'm gonna suck. It's like a long, slow drag if you ever were a smoker, but that's what I tell people. It's like a long, slow drag. It's not like a, whoo. No, that's not how you do it. You want the long, slow drag because that trains your lung sacs to remain open. So like this. Okay, and so now I put the little ticker right where I was. And then I only do one breath and then I rest. And so you take one breath, you rest, and then you take a few breaths normal, and then you do it again. And I want you to do that 5 times in a row, okay? With rest in between. And then do that at least 3 times a day. And then if you can, if you're sitting in the chair watching television all day, if you're awake, do it every hour, or every time there's a commercial break. Do 3 every commercial break. The more you do it, the more it's going to help your lungs, because you want to train your lung sacs to be open so you have more oxygen flow throughout your lung and you don't have to struggle as much when you get up to go to the bathroom. So that's the goal, is to be able to get up and go to the bathroom, or walk outside to your mailbox, or go to the kitchen without being short of breath, okay? And even if you're just sitting there, I've had people that were unable to walk from their recliner to 20 feet away to their kitchen table without oxygen, being short of breath, being able to walk around the block and not use oxygen at all. And I've had other people titrate them down just a little bit of oxygen a week while they do their exercises and add lemon juice to their diet. They have been able to come off oxygen as well. So it can be done. It's just what stage in your disease process you're in, how motivated you are, and yeah, so it does take some motivation. And I've had cute little lady with non-healing wounds add the vitamin C to her diet, and she just sat this by her television set and she did it like every commercial, and it even improved her brain function, because your brain needs oxygen, and when you're taking shallow breaths and not running at marathons anymore, your brain function's going to suffer too. And also with the vitamin C, that cleans out your arteries, so it has more open arteries, can get to your body and your internal organs better. So vitamin C, natural vitamin C, cannot be from a pill, gummies, or any other crystal light. No. Okay? So I just wanted to share that with you. And if you have any comments, please leave them down below. I would love to hear from you. If you have any questions, I'd love to hear from you. And God bless. Have a great day.